2010 was a relatively high moment for mental health providers. With the passing of the Affordable Health Care Act, people were very hopeful that finally people that we knew needed access to services would have an opportunity. And so most of us were planning for increased capacity. We certainly in our health centers were thinking about how to create that increased capacity so that everyone who had access now to health care would have it. We started to look at all of the places where people had been on waiting lists as an opportunity to begin to serve more people. It seemed like a best of time moment, but it was happening at the same time that unemployment was over 10% in Philadelphia County, and our tax base was sharing. And then the shoe dropped. And in 2011, our funding at the state level was somewhat flat, and in 2012, it dropped. And the floors basically fell out because, as Dr. Evans described, there were, even though they were experiencing a 10% cut, they couldn't cut across the board. So some programs had to maintain their funding and others had to take deeper cuts. We experienced those deeper cuts in the elimination of day programs. And these day programs were a complement to services for people who are living in the community. This was a way of supporting them, that they would have a variety of activities that they would participate in during the day. We had 4 programs and 2 of them were cut. One that had actually been in existence for over 20 years, Artists for Recovery. If you enjoy outsider art, as you look to this side of the room, you will see some of the products of people who participated in our outsider art programs. And so this was a way of supporting people currently living in the community as we plan to create opportunities for more people to live safely in the community. That program went away in December. Another program went away in July. And so the loss of those 2 programs means that that first line of defense for people who live out in the community is gone, because that's where people go on a daily basis. That's where they make a connection. That is where, if they're having some kind of a challenge, it will be picked up there and that person will get support for the next steps that they need to take. So our Silver Springs program went away, and our Artists for Recovery program also went away. Also, the plan included for expansion of outpatient services. As people move into the community, outpatient services is one of the places that they need to be able to connect with. Outpatient rates have never supported the service that's provided. So most agencies have to take a resource from another service that they're providing to cover the shortfall in outpatient rates. So that rate continues to be too low as more and more people need to take advantage of that service. The service also is very limited in meeting the needs of specialized populations. We're not as affirming as we can be in outpatient services, and so really we need to have the resources, the training that would allow us to work with specialized population, like people who are not criminals, who have problematic sexual behaviors, like members of the LGBTQ community need to have affirming places where they can go to. There's only one clinic in Philadelphia that actually embraces and advertises and does outreach, and that's the Mazzoni Center to the lesbian, gay, bisexual, queer, transgender population. So that's an area that we had hoped that funding would be provided, that we could also begin to meet the needs of that community. Mental health transformation, we believe, is a wonderful thing, that people who've been in congregate care for decades now have an opportunity to live out in the community, have a higher level of independency, and have the support that they need. So when the city talked about that plan, it was a great thing because it was going to be an opportunity to create some fluidity across the system and to move people who've been in congregate care into the community and to move people in state hospitals into the community where they can also get the support that they need. It has been a challenge to deliver those services because of the cuts in funding. Because in addition to moving people in the community, there have to be community-based services that meet the needs of those individuals once they're there. I think the last thing that I want to just emphasize was the elimination of general assistance, and you heard Dr. Evans talk about that. It again reduced our need to serve people. There's a segment of the population that we serve in safe havens. Safe havens is the first step out of shelter. And we operate 3 safe havens specifically for individuals with mental illness and possible addictive disease. They were generally entering into the system. They're ahead of applying for disability. That general assistance was the only income that they had to provide for transportation, to outpatient services, transportation to any of the places that they needed to go, personal items, and also a portion of that was their contribution to the poorly funded safe haven programs, recovery houses, halfway houses, that they also often enter as their first step in recovery. Some of those recovery houses unfortunately had to cease to operate. Others are already on a shoestring funding, are continuing to have to cobble together services to serve that community. But that elimination of general assistance has made a difference in those programs. Resources for Human Development operates 3 safe havens in Philadelphia, 1 for men, 1 for women, and 1 for couples. And so those budgets are stressed by the fact that the participants in the program no longer make a contribution to the short funding that was there, and now these folks also don't have basic cash to get to an appointment, to get to an assistance office, to apply for Social Security, to see a psychiatrist, because those services are not available at the facility. And so it has created a real stress on the system as we try to meet those needs for the people that we're serving. We serve close to 90 people in safe havens, homeless, mentally ill people. And so I just wanted to add to that this is another area where it didn't seem to have a big impact. It's had a big impact if you're a provider of this kind of service and you're homeless and you need to get to the next step in your recovery. I think the last thing that I would say is the people that work for us, they're the real troopers. They're on the front lines, and most of them don't make a living wage. And so we can't support them in continuing in this profession because they have to go where they can potentially make more money. And so the turnover rate is high. Just the fact that they are themselves one paycheck away often from being homeless, being in the same situation as the people that they serve is extremely stressful. So thank you for listening to me. Those are my comments.